Hi, I am Dr. Rajurkar. I am working as a professor and head Department of Veterinary Pharmacology and Toxicology. Now you know that this department is divided into two parts, that is pharmacology and toxicology, where we deal with the drug, that is the pharmacology. Means in this pharmacology, we deal with the efficacy of drug dosage forms, how the dose of the drug is decided, how the contents of the drugs are decided, what should be the proportion, what should be the concentration of each of the ingredient in particular drug. So this is decided, the source is studied in pharmacology, the drug is formulated, that is the pharmacy, and all after that the drug is finally brought to the final form of the drug, that is drug dosage. Maybe a tablet, syrup, injection, like that. So this study is done in pharmacology. Now the remaining part, that is the toxicology, where we study the adverse effects of the drug. See, when we take any drug, we know that each and every drug have its adverse effects. If it is given in higher doses or if it is given for a long duration, it may cause some side effects or adverse effects on a human or animal body. So this study is done in my department, that is Department of Veterinary Pharmacology and Toxicology. So togetherly, we study with the efficacy of drug, and second, we study with the toxicity of the drug. Now when we say the efficacy of drug, and if we go for the history of pharmacology, if we go for the history of drug, in ancient period, the drug means a medicinal plant, a dried herb. So Indian history, if we see the Indian culture, we are the pioneer, we are the origin of Ayurveda, that is the use of medicinal plants in animal diseases, in human diseases, and there is one branch that is called as Pashu Ayurveda that includes the use of medicinal plants in animal diseases. Means these drugs, these herbs are equally useful in animal diseases also as are equally important in human diseases. So in veterinary medicine, that is in animal diseases, we use these drugs. In our department during our post-graduation studies, so we have every year we have intake capacity of 3 postgraduate students, that is MVSC students in our department, at the same time PhD also. So during their MVSC or PhD curriculum, during their research, we have started working on the medicinal plants, that is uses of medicinal plants in treatment of animal diseases. So we have a well-equipped lab animal house where we study these effects of the drug and even toxicity of the drug, which are based on international levels, that is the OECD guidelines. So these students work on, till date we have worked on number of medicinal plants in disease of animal. But when you think of the dose of the compound, the dose is, if you go for the definition, dose means what? It is the minimum concentration of a drug which gives the desired effect. That means what is necessary is minimum size of the drug, minimum concentration of the drug, minimum quantity of drug. So as to minimize the dose of drug, we have started working on nanotechnology. That is use of some nanomaterial, nanometal particles. We have coated these nanometal particles using some herbal extracts and successfully treated diseases in animals. So up till now we have worked on diabetes, we have worked on cancer-like studies, and this has given very promising result for the drugs which are coated, which have been coated with the nanoparticles, metal nanoparticles, maybe gold nanoparticles, silver nanoparticles, copper nanoparticles, like this. So this study, that is the working on the efficacy of drug, at the same time toxicity of drug, nanoparticles, medicinal plants, this study is done in my department, that is Department of Veterinary Pharmacology and Toxicology. Thank you.